A bombshell from the Health Minister revealing bullying and infighting between doctors is putting patients at risk in Adelaide's major public hospital. A toxic, long-standing feud between some medicos reaching crisis point.
A sick state of affairs, the Health Minister telling Parliament of a poisonous culture within the Royal Adelaide Hospital.
Some of the levels of dysfunction are unprecedented and present a real risk to patient care.
If doctors or nurses are under stress, then that's going to affect it.
Really sad that there is that culture that people can't work together and get along together and communicate.
Definitely should be happening, and I don't know why it happens.
A spat between doctors in the cardiothoracic and intensive care units was bad enough to prompt intervention, but a year on, a review's revealed tensions have escalated.
Stunningly, the report highlights incidents of bullying, derogatory behaviour and a lack of respect for fellow professionals.
Nurses in the firing line, some the subject of anonymous bullying notes.
I find this kind of abuse of authority over the hardest working patient carers reprehensible.
The extent detailed, taking even the nurses' union by surprise.
We're unaware until today the extent to which bullying was identified as being a particular risk.
The system is clearly under stress, and after 12 years of Labor leadership, the culture is so toxic that it's not even safe for workers to work together.
A blunt message to the minister's own staff.
Your behaviour is childish, unacceptable and potentially dangerous.
Live now to Tom Richardson at the Royal Adelaide. Tom, what's the government going to do to fix this?
Well, to start with, they've put new faces at the top of both troubled units. They'll join authorities in implementing the recommendations of this report, including performance management, an overhaul of how the unit is configured and the rostering of specialist nursing staff. And no doubt there will be another review, with the Minister telling Parliament this sort of behaviour wouldn't be tolerated in a schoolyard, let alone in an intensive care unit of a major public hospital.